Hey health warriors! Ever cared for a patient who walks bent forward just to relieve their back or leg pain? They could be dealing with spinal canal stenosis, a progressive narrowing of the spinal canal that can impact mobility, pain levels, and even bladder function. Today, we're breaking down what nurses need to know, from causes and symptoms to treatments and patient care. Spinal canal stenosis is a condition where the space inside the spinal canal narrows, compressing the spinal cord or nerve roots. Most commonly affects the lumbar spine, but can also involve the cervical or thoracic spine. The result: chronic pain, numbness, weakness, and functional limitations. Causes and symptoms: degenerative changes from aging, which are the most common. Herniated discs, bone spurs, also known as osteophytes, thickened ligaments, particularly the ligamentum flavum, spinal injuries or fractures, congenital narrowing or scoliosis, a history of spinal surgery or tumors. Symptoms to watch for. Spinal stenosis develops slowly and often mimics other neurologic or orthopedic issues, which can delay diagnosis. Symptoms to watch for include back pain, especially when standing or walking. Neurogenic claudication, leg pain, numbness, or heaviness with walking that improves when sitting or leaning forward. Diagnostic evaluation and management. Weakness or tingling in the legs, gait instability. In cervical stenosis, you might notice hand clumsiness or balance issues. And in severe cases, there can be bowel or bladder dysfunction. Diagnostic evaluation is crucial. An MRI is the gold standard to visualize soft tissue and nerve compression. If an MRI is contraindicated, a CT myelogram is used. X-rays can show bone alignment and degenerative changes. A neurological assessment will check strength, reflexes, and sensation. It's also important to rule out peripheral vascular disease, neuropathy, or disc herniation. Medical and surgical management options are available. Conservative treatment includes physical therapy for posture training and core strengthening, NSAIDs or acetaminophen for pain, epidural steroid injections, and activity modification. For severe or worsening cases, surgical options include a laminectomy, which removes part of the vertebra to relieve pressure, spinal fusion if instability is present, and minimally invasive decompression procedures. Nursing care and complications should be closely monitored. Watch for neurovascular changes in strength, sensation, and reflexes. Assess fall risk due to weakness or numbness, and monitor pain levels and response to treatment. Post-surgical signs like CSF leaks, wound infections, or hematomas also need attention. Educate patients on proper body mechanics, the use of assistive devices like walkers or braces, and when to report worsening symptoms such as new weakness or bowel and bladder changes. Emphasize the importance of physical therapy, follow-through, and gradual activity progression. Bottom line, movement matters, but so does monitoring. Spinal stenosis can be life-altering, but with the right care team, including you, patients can manage symptoms and maintain mobility. Have you helped a patient through spinal surgery or rehab? Drop your best nursing tips in the comments, like subscribe, and follow for more musculoskeletal breakdowns that help you support healing from the inside out. And remember, relieve the pressure, restore the strength, support the spine.